Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and I've released a lot of content on root canals and hidden infections. But I wanted to do a quick summary for a lot of the patients who are seeking answers on if they need to have a root canal done or if they need a root canal removed. Now, root canals are still one of the most overdiagnosed procedures in dentistry. Something like 44 million root canals are done a year. And I just saw a patient yesterday that had 2 root canals done unnecessarily when the actual tooth that was bothering her was misdiagnosed. And my goal, first of all, is to find a pathway to preventing root canals. I try and do really conservative dentistry. I have some advanced air abrasion that I can do to conservatively remove tooth. I could use lasers, or my favorite is to use ozone over really deep areas that are near the nerve. But I like to try and catch the cavities or the cracks before they're a problem. My goal is to always do conservative dentistry that preserves the most amount of tooth structure possible, because a lot of dentists really aggressively grind down tooth structure, which is overall very traumatic to the tooth and creates a separate amount of issues other than just if a cavity is deep and close to the nerve. We also have to be really careful and on top of our bonding technique. I've gone to a lot of advanced education, even this year, even though I've been doing dentistry for over 21 years, just to always stay current on what is going to give the tooth the best result long-term and also make the tooth the happiest. If we follow really good conservative bonding protocols, the tooth will stay happy and not even know that anything was done to it. So that's a passion point for me. But what if you need a root canal? First of all, you're going to want to make sure that you're seen by a specialist. We work closely with 2 specialists, one of whom is right across the street, where I can get you in the same day, where if you're going to have a root canal, you want to make sure they're treating it with lasers and advanced 3D imaging and also ozone. Now, would I rather have a root canal done or have an extraction? That's really tough to say because it depends on the condition of the tooth. Most often the root canals are done in a very quick and rushed fashion, and they're done without 3D imaging. So a lot of debris and bacteria is left behind, and essentially the dentists are just removing the bulk of the nerve, soaking the tooth in bleach really quickly, and then filling up the tooth with a lot of non-compatible biomaterials that are often rubber and metal based. So you want to be careful about how they're doing the technique. Now, if a root canal is failing, do I want it out? Absolutely. These hidden infections can go on for a long time and not cause any pain to the patient, but they can cause a lot of health issues. So that's something a lot of people come in for, is for us to take an advanced 3D imaging and go through each slice and look for some of these hidden infections. But I don't like taking teeth out if we don't have a plan for replacement. It's really, really important. There's a lot of studies that have shown that you need at least 10 paired teeth to have proper digestion, function, and posture. So craniosacrally and digestion-wise, every time you lose a tooth and you lose its mate, you end up collapsing your ability to be healthy, essentially. So those are all factors I consider, but most importantly, I'm always going to try and approach my dentistry with a way that's going to try and prevent problems in the future and prevent root canals. I hope this answers some of your questions, and if you're interested in finding out more, come reach out to us at Moonlight Beach Dental.